My name is Dr. Nicky Kimber-Rogal, and I'm a chartered psychologist. Interesting journey. Initially, I was actually involved in musical theatre. This is going back a few years, and I started seeing a therapist myself because I was, I think, perhaps for relationship issues or something like this. And my sister-in-law was also a psychologist, and I became very interested in psychology. So while I was still doing musical theatre, I started from the basics, an A-level in psychology, an undergraduate degree in psychology, a master's in mental health studies, and a PhD at Guy's Hospital. And the PhD involved looking at the training I did for psychotherapy, which was cognitive analytic therapy, which I base my work on now. I think what I find most rewarding is seeing the courage and innovation of the people I work with, how we work together, because I work in a very sort of egalitarian way. Although I have qualifications and I need to do my job, I don't see the person as a patient as such. I see them as somebody who's been very resourceful and has come through difficult times and is going through difficult times, perhaps, but we work together. So my job really is to work with that person on what they feel they can do in incremental changes and to encourage them to go with that. So I think encouragement and reassurance, some psychologists don't like to use reassurance, but for me, I think it's a very, very important part of my work is to talk as a human to human being, try not to use too many psychological terms, and really to see the person with, I think Rogers, the psychologist said, a positive regard. So looking at that person, they can do it. So we're trying to move that person from a feeling of I can't do something to I can. So we have hope. And so in answer to your question, I guess the reward is when they feel, yeah, I'm more or less okay. I might not be the best person in the world, but I'm an okay person. What do they value? I think they value the fact that I'm honest with them, and that they feel not judged. Often they say they don't feel judged by me. I think they value the fact that I am quite open and I would be relatively self-disclosive with them. So I wouldn't tell them about my life story necessarily, but I would say, you know, that I could understand how they may be feeling the way they do, and that it's part of a human experience to feel. This is not something, again, that's a pathology necessarily. Some, you know, if they have a psychiatric diagnosis and something's, you know, already been established, that might be a bit different. But generally, people are struggling with aspects to life that they feel they can't control or they're not good enough, and so on and so forth. And there's a lot in our culture of individualism and comparison, so on and so forth. And I think the communication is what they value in me, and I value in them, really, that we're actually, once we start communicating, then we realize that we're all, you know, part of the moving mass, really. We're all the same. So I think openness and communication they value in me, and what I value in them is probably more or less the same, that they will communicate to me in a way that they don't feel they have to pretend or to compose a narrative about themselves that doesn't really touch what they're feeling, thinking, and how they're behaving. So it's an honesty, I think. Yeah. I think a mantra or catchphrase is a tricky one that I would say, do as you can, not as you can't, would be my main catchphrase.